evening, everyone. Hopefully you can hear me okay. Welcome to the very first of our new series of live streams. So this one is called Care Uncut. And what we're trying to do with Care Uncut, we're trying to cover some of the more recent relevant news that's happening in social care. And we're going to be discussing some of the things that we're experiencing as social care providers, as people who are supporting social care providers, and really trying to debunk some of the myths about what social care is all about at the minute. So we're going to hear it right from the source. And this evening, I'm absolutely delighted, always my support system. I've got two wonderful guests, of course. I know Deian and Glyn very well. And David Smallacombe, who is the CEO of Care and Sport West, which is a local care association in the West, so covering Bristol, North Somerset, South Gloucestershire area, and also Deian, who's the chair and also part of Manor Community, one of the directors. So that would be really good to speak to them in terms of what they're facing, what they're seeing care providers are facing within social care, and also to respond to some of the things that are happening in the news that are affecting social care providers or anything around social care. So welcome. And as I do always, I try and remind people to sign up to our YouTube. If you're watching us on YouTube, make sure that you subscribe, and if you like it, then that just brings more people to the channel, which is always helpful. If you're on Facebook, then like our page, and comments. We'd like to hear your response to what we're talking about. If you think we should be talking about something else, or you're not quite agreeing with it, just put it in the chat. And we'll cover it, and we'll have a good old natter. Totally relaxed this time. So this is less. We had the mayor of Greater Manchester last week. We were talking about maternity care as well last week. Lots of presentations, lots of deep discussions. This one is totally more relaxed. So I hope you're all going to enjoy it, and then just tell us who you want to hear from. A couple of things to mention before we go into it, and that is on vaccinations. So we've been working really hard to get together a group of professionals to be on a panel to talk about vaccine hesitancy, and really not to talk down at people and say you should have the vaccine because you just should and it's good for you, but to answer questions. So if you want to know if the vaccine has got jelly beans in it, or if it's halal, or whatever you want to know, you can ask questions. So if we can get the overlay for it. Yes. This is all now organized for Monday, the 8th of February. That's next month, in a couple of weeks' time. 6:30, so same time. And we will be talking we've got about 5 or 6 GPs, we've got an immunologist, and another expert as well. So you'll be able to ask them questions directly. So just spread information about it. We've got a link which is live now on our YouTube channel. We'll be streaming it on Facebook and YouTube, and you can ask any question. If you're working social care, if you're a frontline worker, if you've got any questions at all about the vaccine that you're a bit worried about asking, or you think you've just got no one to go to for it, then we will be opening up the floor and allowing you to ask those questions. So please do get involved. Great. Okay. So just a couple of things that I thought were quite interesting to cover in terms of news-wise and what's happening. I think I spoke before about a new regulation, or consultation rather, that was going on. I hope this is the right one. So what CQC were planning to do, and it's not CQC, the government were consulting on whether to regulate the movement of staff between services. So that's care services, only applicable to care homes. So it would be added to current regulations, and just the ultimate penalty, as with any of these regulations, is that a provider could be prosecuted for either employing agency staff, because of course in the first wave we knew that people had to employ agency staff because their staff were going down, but also for sharing staff across services. So there was going to be a penalty. That's the ultimate penalty. Some people might say, well, what they were proposing in this regulation was, not necessarily to put people in jail, but you would have to provide more paperwork, and you'd have to prove to the regulator, CQC, that you weren't doing anything that was unsafe. Now, of course, myself and people on lots of groups were trying to encourage care providers and care managers to respond to the consultation, because I've never seen anything where the NHS staff their managers are faced with prosecution if they share staff or if they employ agency. So it was a classic lack of parity between NHS and health and social care. And so there was a big issue around it. And I know that a lot of us were really upset that they were even proposing at this time when we are so stretched and so stressed in social care to then put in a measure to be able to prosecute providers for employing agency staff. Just seemed absolutely ludicrous and totally out of touch. But we've got some great news, because this week it was announced, I think either early this week or late last week, that that's not going through. Why it was ever proposed in the first place, I have no idea. But that is one of the pieces of news that's been happening. Also, there's some things to be talking about around LFD testing. And of course, now, unlike before, another lack of parity so this is testing that we'll come on to a bit later, that's care homes have to do. So this was announced on the 23rd of December, a new guidance was put out day before Christmas Eve, as you do, where care homes had to do the LFD quick tests in their care homes. If you've got an outbreak, it's every day. And of course, it's very difficult to administer. So what was proposed and what is being done at the moment is, of course, that people do that in their care homes and have the extra staff to process that. Can be really difficult. One of the things that the NHS staff and health staff are doing, of course, is to allow their staff to test from home, because before you get on a bus to come to work, it makes sense if you do the test from home rather than getting to work and then testing and finding that you're positive. So this was a lack of parity, because the guidance said, the MHRA said, care staff can't do that. In the guidance, it's not allowed, but now we've got the okay. So there's a few things that are moving along quite nicely. And of course, the announcement recently that all frontline social care workers who have close personal contact with those who are clinically vulnerable to COVID-19 can be vaccinated. And of course, there's a lot of variation going on there. So a couple of highlights, but enough of me talking. I'm going to bring in our guest, David. Hello, David.
Hello there. Evening, everybody.
And Deian. Am I very grainy? I feel like, no, I'm okay.
Definitely look better than my picture. Yeah, that's fine.
We were just saying earlier, you look like you're in an interrogation room.
I know. You know who's got the nice part of the house.
What? Yes. Welcome both. Welcome, David.
Thank you.
How are you this evening?
Yes, very well, thank you. I've got my apple juice ready. That's really good.
So you're drinking apple juice?
Yes, apple juice. Yes, that's the one.
Also known as whiskey, maybe.
Possibly. Who knows?
Wednesdays. Well, I've got my non-alcoholic cocktail here.
Yeah,
so
well, of course.
We've made it to Wednesday, so that's something to celebrate, I think.
Yeah.
Okay, so let's get straight into it. Where should we start? LFD testing discussion. Go. So I've did a little bit of an intro on the LFD and how it's a lot of pressure for providers. What are you hearing, David, from your members around this? And is it working? Are they glad that they've got it because they can spot cases earlier? Was the introduction of it just a little bit shoddy? What are you hearing?
Well, you know me, I want to start where I want to start. And just a couple of things, if I may. First up, we don't just work across the BNSSG area, we also work across the Bath and North East Somerset area. So I just wanted to remind people of that. But the thing I wanted to say right at the front end is this whole information that we've been receiving just recently around this enormous number of deaths in across the country, the 100,000, and I think the figures probably tell us that something like almost 1% of those deaths are from the care sector. So it's a really important, well, it's not important, it's, I just wanted to acknowledge right at the front end that, this is the kind of pandemic that we've never seen before, and that we're really living through a very difficult period. And in all of that, I just wanted to make reference to the fact that, people who work in care, the emotional cost, the absolute emotional cost of working in a care setting, things like, some of the people they cared for are dying. What about the families that are really, really focused on how to support their loved ones and so on? What about the health of their own family, their own health? And some of these people, not only that, rather like you and Deian, I know, are also homeschooling, for goodness sake. The pressures that people are on, carers or care for relatives and so on. Your question was about testing and LFD and so on. And that's a really, really good thing, as far as I'm concerned anyway, but it's a real pressure. So you made reference earlier, for example, to, if you have an outbreak, then that takes you into daily LFD testing and weekly PCR testing. I may have got that wrong, but I think that's right. I mean, Deian will probably have some things to say about that from a provider point of view, but these are some of the things that jump off the page to me as being real emotional costs for staff, work pressures, home pressures. But Deian, you probably have, well, not probably, I know you have experience of that rather more directly than me.
Yeah, I think the LFT testing and PCR testing, any testing basically, is, I think most managers and most care services welcome it, because it's better to deal with something that than the unknown, if you like. So I think it was all welcome. I think the way it's been done could have been done a lot better, but that's probably the same as most things throughout this pandemic. And also is welcome news this week, obviously, that we've finally now know, or we'll find out very shortly, if you don't know already, that what monies you'll get to help you administer that LFD testing on a weekly basis. But again, it's giving you money that needs to be spent between the 31st, I think, or the 23rd of December to the 31st of March, of which we're halfway through the period already, before you even know what kind of money you've got coming in. So I think a lot of things could be done better, but I think the testing, obviously, it's more pressure on the managers. I think all the managers, certainly that I've come across, and certainly in our own organisation, are feeling the pinch. I think especially when you've got outbreaks as well. But again, I think it's difficult to say that it's a bad thing, because it's not. But I think everybody must acknowledge that it does become a lot of added pressure as well. But then the stress of the unknown is even worse, I think. So I think knowing that you've got people that you need to send home because they're not well is better than constantly thinking, has that person got COVID and things like that. So I think, for most businesses, for most managers, you're better off dealing with what you know rather than the unknown, I think.
Yeah, it's both, like most things in life, I guess, it's both bad and good. It's really used. I mean, the whole kind of testing and vaccination, and we'll talk a bit more about that in a minute. But the whole thing is clearly, as far as I can see anyway, that kind of light. This is how we're going to manage ourselves out of what is a crazy pandemic. But at the same time, it brings to provide, and we find ourselves at Care and Support, we're supporting all sorts of providers who are wrestling with this kind of issue. And just only yesterday, one of our providers called us, and she was talking to me about a staff member who was saying, I'm not going to do these LFD tests, thank you very much. We know we're doing too much already. And we had a conversation about how best that could be managed, and the kinds of conversations that she needed to have with that staff member. But these things, I mean, that isn't unusual, but it's a real additional, but that's in addition to the to the day job that one used to remember having, because the day job hasn't gone away.
And
yeah, carry on. Sorry.
Yeah, no, that's the thing. You've got the day job of running a care service, plus you've got all of this extra stuff that you have to do, like the LFD training. And it's really interesting that you brought up that subject about a manager's feeling just overwhelmed and saying, I can't do it. But of course, we've got this problem, and I've played it before and I'll play it again, about our wonderful Prime Minister criticising care homes for not following the guidance.
We need to think about how we organise our social care package better, if you remember, and how we make sure that we look after people better who are in social care. I think we discovered too many care homes didn't really follow the procedures in the way that they could have, but we're learning lessons the whole time. Well,
they're not learning lessons quick enough in central government, in my view. If you even just look at the area that we cover, South Gloucester, all that, that whole kind of west of England area, it is a fact that the majority of care homes have been able to lock the COVID out. Now, there are lots of outbreaks, and the outbreaks now are sometimes quite specific in relation not to residents, but to staff. Now, people have to live in the community. We all do. We all live in the community. But no, it's right. The learning, he talks about learning in care homes. It would be useful sometimes, I think, if the government were to listen to the learning that's already gone on in care homes. But that's my soapbox.
Yeah, no, it's a good one. I want to move on to vaccination.
Yeah.
And how difficult that they can be. And of course, the whole idea has been to try and do vaccinations in care homes first. And I won't play it now, but I was talking about the whole idea of vaccinations and how actually you needed other services to be on the list for vaccinations. And it's time critical because whereas you didn't have outbreaks before Christmas, now after Christmas, with the rules being relaxed, it's and of course they say that the variant is causing a lot of problems. It's just it's so time critical, because if you don't have it this week, you're finding people who are vaccinated and a couple of days later they've got COVID. So in terms of vaccinations, how do you feel, Deian, that's gone, the rollout?
Yeah, I'll just go back to the last point quickly. It did make me laugh, because if you look at social care, I think realistically over this period, social care has done exceptionally well generally. I think there'll always be some care homes that maybe didn't follow the guidance. But if you look at sort of the NHS, there'll be plenty of hospitals that didn't follow the guidance in terms of discharge procedure. They're still doing it now. You still get reports where care homes are being told to take people even when they haven't been tested or they haven't gone through the COVID isolation period. So I think it is social care is a very easy one to pick on, I think, because it's mainly made up of voluntary providers and obviously private providers. So it's an easy one to think, but I think, just like with the outstanding and the good ratings, social care actually does very, very well compared to the NHS. And I think in terms of the pandemic, and I'm not knocking the NHS because I think they've done a great job and they really are on the front line as well. But I think it's social care has always been an easy one, and I think the Prime Minister has just taken advantage of that there. In terms of vaccinations, I think it's probably one of the things that certainly the government think they've done well on. I think most people think they're doing quite well on. I think it's a welcome thing for care homes and for everybody in the care sector. I think we have had a lot of stories. I've heard a lot of stories now where there have been outbreaks after having certainly the first dose. I've got big concerns about the gap between, changing the guidelines in terms of when they should be having the second dose. I think that's a big risk as far as I'm concerned. Certainly with when we're talking about the vulnerable people in the care sector. So I think, whilst they've done well to date on the vaccinations, I think time will tell whether their current strategy will work or not. I think that's. And I've been really pleased to see, just to say quickly that before David comes in, is that I've been really pleased about the staff uptake. And I think there was a lot of concern. Obviously, Coproduce Care did their own report on sort of vaccination hesitancy and thing. And certainly I can only speak about our organisation, but also some of the organisations in Cairnsport West. We've been very pleased with the amount of people who have been vaccinated so far. And I think the stuff that's going on now with the webinars and the myth busting, hopefully will increase that further.
Yeah, one of I think absolutely, I agree with you, Dan. The numbers in terms of vaccinations are really good, and I was in a meeting the other day where people were talking about, I don't know, somewhere around 80% of care home residents and staff having been vaccinated in and around the Bristol area, which is great. One of the things that really concerns me, though, is the different information we get. You know, it depends whether you listen to Radio 4 or some other radio or read one paper or another paper. What you get is different information about this, you know, the efficacy, the safety, all of this kind. And one of the things that really worries me is the influence of social care, as the social media around all of those kinds of things. And that's part of the reason why groups of people are concerned. You made reference to this earlier, to Sophie, but it's a real, we can't knock social media because it's really, everybody should be able to say what they want to say and everybody should be able to ask the right questions and make the right comments. At the same time, when you're living in the middle of a crazy pandemic like this, it doesn't help some of those things. I don't know, Sophie, am I talking out of order here, do you think?
No, here's the thing about vaccination and hesitancy. We are very much in our own little bubble in the UK. And what I've been hearing over the last couple of weeks, hesitancy isn't necessarily to do with certain BAME groups or certain people with religious views, but actually some people who tend to have an international outlook because UK isn't where they were born, or they've got people who are abroad, are getting news from family and friends who are hearing the stats in the UK of how well we've dealt with this pandemic, or the government has, and they're hearing it and they're saying to their family living in the UK, please be careful, please just watch yourself. And so when we now come from dealing with the backlog and the delays in 2020 to now what should actually be a really positive thing, which is the vaccines, you've got a huge issue of trust with whatever the government is trying to push, even if on the face of it, it's extremely positive. So I think what we don't realize in this country is that some people, the root of their hesitancy isn't necessarily because they've got some unusual belief. That might be part of it, but it's because of the trust. And it's something that when we did our survey, we found that trust was one of the issues that people had around the vaccine hesitancy. And you'll never hear that reported because mainstream media is just trying to put a positive spin. And we'll talk about how well we've done around the pandemic a bit later. But I think that is something that is underneath all of this, is how generally we've dealt with it. How much can we trust a government who seems to be making mistake after mistake after mistake?
Yeah, if I wanted to make some reference to, if I can, I talked about the emotional costs for staff earlier. I want to talk a little bit about, if I can, about the emotional costs for businesses. Oh, is that businesses? Is that the right to say it? Anyway, lots of business. And you know, if you just think about it, think about what's going on, you know, managing outbreaks, staff isolation and illness, pressures from CQC, placements going down. So business sustainability becoming really difficult, safeguarding worries, public health pressures, family visiting management, you know, testing, you know, that's just, that isn't the full list of stuff. But if you're running a care, and these are the things that we're here to try and support people about, but these are the things that people are having to wrestle with every day. It's a real, I think it's a real concern for organizations, and you know, fair dues to everybody, because they're doing really well in all of that pressure.
I'm conscious of time and we want this to be a shorter session. So for the last a couple of minutes before I want to go on I didn't tell you this, but I'm going to bring back the cactus question. But I want to find out from your point of view, Care Support West, what have you been doing to support providers most recently, and how has it worked? Is it making a difference in your local area?
Yeah, well, one of the things we hear good feedback around is the whole kind of communication stuff we're doing 2 or 3 times a week, which is sometimes about COVID, but it's also about other kinds of things as well. So the care sector generally, we do regular workshops, which people will have come across. The last one was on staff well-being, for example. And one of the things that went on during that workshop is that people had takeaways, not takeaway meals, you understand, but takeaways that they could go away and use with their staff teams. What we're trying to do is support people in that way. And also we're really ready to support individual providers. So just over the last little while, we've talked to people, over the last 2 or 3 weeks, 2 or 3 months, we've helped people think about their raises in insurance costs, their safeguarding management stuff. What about how they manage test and vaccination challenges? I talked about that earlier. Something about I was talking earlier today to the BBC Radio Bristol, not in an interview, but to give them information about what's going on in the local area. Sometimes we need to challenge councils, and we've been doing that on behalf of providers about all sorts of things. So those are the kinds of things that we've been doing over the last little while. And some of that's connected to COVID, but quite a lot of it will be ongoing and into the future, whether COVID, not whether COVID is here or not, but even as COVID lessens as a pressure. Those are some of the things we're doing.
Dan?
Yeah, I think David's probably summarised it quite well, really. And I think the biggest thing Care Support West hopefully does for its members is gives a space for people to talk to each other. And I think that's the biggest thing. And probably the most positive thing from the pandemic, I think, is that more providers have been willing to speak to each other, speak honestly about their issues and what they've been doing and the good practice they've been doing, willing to share documents, share things that have worked well in their home or in their service, whether it be a domiciliary or support living service, and then giving takeaways for other people to take away. And then obviously the co-chairing, David's obviously co-chaired the Coproduce care calls that have gone really well. And I think we've and also the pandemic has opened up some new avenues with the local authorities, I think, and different approaches for both sides, from Care Support West and providers and from the local authorities. And I think that's been welcome. So I'm hoping that members will feel that. And I think the biggest thing from my point of view, and the reason why we joined Care Support West all of those years was that, as a provider, it can be a very lonely place. And I think, and as manager, and I think, having workshops and having someone to call that can put you in touch with another provider that is similar to you and that's gone through things, I think that's invaluable for myself. And I think hopefully that's what providers and members are making use of best at this current time.
Thank you. So I don't know if anybody was following us before COVID. We were doing these videos. We were doing them in the presence of, so not remote. And I had a cactus on the table, and the whole cactus thing was to introduce our cactus questions. Our cactus questions are prickly questions about health and social care. So cringe, but I love it. So this one, I'm going to let. This is Ash Sarkar who's speaking on Navarra Media, and she's talking about the response from the government. But the reason why it's relevant now is, of course, on all of the broadsheets this morning. It's about the statement that the Prime Minister gave yesterday about him being very, very sorry about all the deaths, bearing in mind what you said, David, about the death rate that we have in this country.
UK has got the world's worst death rate of coronavirus in the world. In terms of our population size, we are much harder hit, in terms of fatalities than much poorer countries. What have the consequences been of that for Boris Johnson? Stability in the polls, not particularly difficult questioning. His cabinet isn't under fire. They feel and look perfectly comfortable when they're on, Mar or Sophie Ridge, a little less comfortable on GMB, but generally they're not in hiding. And politically, there have been very few consequences indeed.
Sorry, there was a bit of sync issues with that, but you got the gist. So I want to find out, should we feel sorry for the Prime Minister that he feels sorry, or do we need to do something different in order to get a better response from our government, any government, to this pandemic?
I'm happy to acknowledge that the man is genuine in saying that he is sorry for what's the deaths. I agree. Let's give him that at least. But at the same time, from a personal point of view, and a professional point of view, I'm very clear that everything has been too late. Lockdowns have been too late. We should now have got border controls. Everybody should be, I've got a daughter who lives in Australia. She didn't come to here and go back to Oz because they knew they'd have to stay in a hotel and pay for it. That's what should be happening. Border controls should be that kind of level of height, and we should be doing that kind. And all of those control things, I think, have been far too late coming in. That would be my personal and professional view in relation to the care sector. It's not been helpful at all.
Deian?
Yeah, I couldn't agree more probably with what Dave said there, really. And I think the problem has been, really, isn't it? Everything's been too late. Everything's been very reactive. And I think even if you look at it from a pure social care perspective, whilst there have been grants to support social care services of different sizes, we have had support with the PP portal, but all that has been all too late. The LFT testing we've already talked about has already been too late. And I think my only concern, and David and I had a quick catch-up, last-minute catch-up before this evening's call, and I think my concern is when we always talk about, social care going forward, obviously we're in a pandemic at the moment, there's a lot of grants and a lot of things going on at the moment that's very, just put a sticker plaster on it, and we will talk about social care going forward. My concern is the current government's got a bad record of being very reactive and not very very well in planning for the future. So I'm a bit concerned that it's been a poor performance. Let's say nothing is, and well, it's been worse than that, and it's been shocking. And I'm concerned that there's not really much light at the end of the tunnel apart from having the vaccinations and things. Long term for social care, I don't see a massive change, and that's my biggest worry, because I think the pandemic has shown a lot of weakness, and it's also shown a lot of good things in social care. And I think now is the time to sort of to really grasp it and sort of move on and really get a plan for the future. And this government, based on the pandemic alone, has shown that it doesn't have the capability of doing that, I don't think.
And people are talking about integrated care systems. They are talking about it, which is a good thing. However, social care is not at the right table talking with people about it. If we miss the opportunity that social care has been brought to the fore, if you like, in this last year or so, if we don't manage that and we don't dine out on that and ensure that our health colleagues not only acknowledge that social care is at least 50% of how care works in this country, then we'll lose that opportunity. So integrated care systems is what health are talking about, but they're not very much talking to social care about it. Let's get it to that table and do that conversation.
Well, I think you two are being way too kind, but then I would say that. I just want to bring up very, very quickly, I'm going to do something different. I haven't done this before. And I am going to give it a try. There we go. Can you see my screen? I'm sharing my screen.
Yeah, I can see it.
So the Dutch government, led by Prime Minister Mark Rutte, has resigned over childcare subsidies scandal. So this was last week, I think, 15th of January. So thousands of families were left in financial ruin following the scandal, in which mistaken fraud accusations were made. And of course, you can read all about it if you just Google it. Now, we have got the worst death rate in the world. We have got our economy failing, and we've got a government who makes decisions on like whether schools should close and changes its whole mind from the, in like 24 hours. And that all impacts on social care, because all our care staff have children who go to school and are in the community. The cactus question, I suppose, is have we got a government fit for purpose to manage the pandemic?
Well, that's an interesting question. Yeah, no, that's lovely. Lovely for you to drop that one in at the end. Great, thank you for that. Have we got a government that's fit for purpose? No, I don't think we do. However, what I would need to see on the sidelines is another one that is fit for purpose. And we're not hearing from either Labour or the Lib Dems any particular message about what they would do differently. Now, that's not to say that we shouldn't be saying to the current government, excuse me, off you go. But at the same time, there's no point in getting rid of one to get a worse one in. So I think it's a real dilemma. And it'll be interesting to see, for example, what occurs in Scotland in May in relation to devolved possibilities there. Also interested to see, as I'm sure Deian will be pleased to hear about what goes on in Wales. And, I live in Wales, so who knows what will happen. But I think that, what we need to be saying to government generally is, excuse me, tell us what you're going to do differently, and then I will make my judgment about who I vote for next time.
Dan?
Yeah, I probably agree again with David's points in terms of, I think it's difficult to say that another party would do a better job in the current climate. I think it is a strange set of affairs where there's not really, given how bad the government has been and the record is clearly, that there hasn't been much challenge. And even if you talk to most of the general population, I think generally people still think that it's gone as well as it could have been, whether that's the media or whatever. I think what it has shown, I think that, to deal with these kind of things and to deal with real issues in the local areas, local leaders need to do that really. And I think, if you hearing sort of Marvin at Bristol and other mayors, they hearing from Andy Burnham last week. Yeah. And I think that really interesting that his points were. And I think he's obviously come out of the Westminster Bible and seen it for himself that actually, real change needs to be done locally. And I think, the points that David made about Scotland and Wales, I think what it has done is people have started questioning it. And I think it's probably a sort of an uncertain future for the UK as it is at the moment. And I think it'll be funny to see, won't it, that the Brexiteers who wanted out of Europe want the United Kingdom to be as a whole because the government was best to rule everybody, even though Europe obviously wasn't best to rule UK. So it'd be interesting to see how they change their arguments on that. But I generally do think, though, I think real change will come locally, and I think more power needs to be done locally. I think the public health, if you look at the track and trace system, clearly failed when they tried to do it nationally. When local councils started doing it, you saw a much better way of controlling the virus. And I think certainly the way forward is a smaller local approach rather than sort of big overarching government, I'm afraid. And I think that's probably the legacy that Conservatives will have to battle with from this pandemic, I think. Yeah.
Very good point. I've never heard you say that before, but yeah, I think that's really good.
I just made it up because obviously I didn't know for the questions. But yeah, that's yeah.
Yeah, and I think you made good points, because what's the alternative? I mean, it's very interesting. It's very interesting because you do see a lack of opposition. And to be fair, the opposition, Keir Starmer, said from the outset, we're not going to challenge the government during this pandemic. He laid that very, very clear, and we're going to support them. So he laid down quite straight right at the beginning, there's not going to be opposition. So then what are you left with? What are you left with? So I don't know the Dutch political system. So I don't know. I think they've got a tripartite type coalition, I'm not quite sure, but maybe they are in a very different position. But I am shocked personally at the lack of opposition there has, and for us as a care sector, I've definitely seen how locally people have stepped up, from the very local individual care workers and managers and associations like yourselves, literally advising local leaders, Westminster, the Department of Health and Social Care, who are really ill-equipped with social care. The Department of Social Care, Health and Social Care is still really operating in the mindset of the Department of Health. And so when a pandemic comes across like this that affects social care in such a big way, I think they were really unequipped to deal with it. So yeah, the local response, very, very interesting. And it's great to have organizations like yourselves that support care providers in this way. And if anyone's in the area, of course, they can learn about Care and Support West, go on their website, join, become a member, and get supported by David, CEO, and his team. So yeah, I think we've cantered through those issues a bit later than we anticipated. But yeah, that was fantastic. Care Uncut, honest conversations about social care. So how did you think it went both today?
Yeah, great, apart from your last question, but the last question was absolutely right. And, you know, it's perhaps the question we should have started with. But I agree, you know, the opposite. You're right about Keir Starmer saying what he said at the front end. But now all we get is you know, pigeon picking. That's all we get is pigeon picking, or whatever pigeon picking is. But, you know,
it sounds right.
It's a phrase I've just invented. But it's you know, and that's no good to anybody. What we want is and I like the whole idea about localism and the way, you know, let's talk to people locally, let's talk to people who represent people locally, and let's get happening locally what people need and want. That's the thing to do.
Excellent, thank you. So thank you both for joining. I'm just going to say a few closing words, but that was really fantastic. Have a lovely evening, both. So yeah, that was the first of our Care Uncut. We're making them shorter, we're making them more relevant. If you enjoyed it, if you thought it was good, if you thought it was naff, any type of comment is good. We want to know if it works for you, if it doesn't. We're going to try and do these every other week if we can, and have different guests on. So if you've only just joined because you've only just had your tea and you've switched on, or you're joining on a different day because you've seen a clip, rewind it back. You can do that. You can watch from the beginning. You can skip through, whatever you like, and get involved. But yeah, thanks for joining. And don't forget, if you subscribe on YouTube, click the bell, because that will tell you when we go live with our Q&A session on vaccinations with our 5-6 GPs and our immunologist and everything else. You can ask your question. Also, we've got other events coming up over the next few weeks. We're going to be quite busy. So yeah, get involved and give us your feedback. Get on Twitter and hashtag us, and yeah, just get involved. So thank you for joining. Have a lovely evening, and we will be with you again soon, sometime in the future. Okay, take care. Bye-bye.